My name is Aubrey Rothrock. I went to UNC Chapel Hill Law School, graduated in '93 and came right up to DC and started working for Squire Patton Boggs. I'm now a senior partner in the firm's public policy group and have enjoyed a long-standing relationship with the Children's Tumor Foundation. When I first started, I would say there were less than 50 people in the Washington community who really knew what neurofibromatosis was. Through a strategy that we developed back in 1995, we were successful in implementing increases annually to the amount of federal research dollars that were dedicated specifically to neurofibromatosis research. And this was done through the Department of Defense, the Congressionally directed medical research program. When we started back in 1996, the annual amount was less than $5 million. And I'm pleased to say that that level has gone up to as high as $25 million per year. So it's been a great success over the last 20 years.
The NF funding account was increased from 20 million to 25 million. So we could not be more pleased with this result.
I've always worked on healthcare policy and federal funding, and Aubrey called me down to his office one day and just started telling me a bunch of acronyms that I didn't understand, and he said, "I want you to work on this." About 3 months later, I was on Capitol Hill with Simon and Annette, and we were pounding the marble floors, making the case for NFresearch.
As we continue to implement our strategy here in Washington, D.C., one advantage of Squire Patton Boggs in our international platform is that we have the ability to do what we're doing here in D.C. and other areas throughout the world. And a natural evolution of our strategy was to focus on Brussels and the European Union and try to replicate what we've created here in Washington, D.C. and do the same thing in the EU.
With CTF, it was a great client to have for a great cause. And so we got together, started to brainstorm what CTF could do in Europe. And so we got off, I think, to a very good start, thought about what CTF wanted to achieve in Europe, and then laid out a path which I think we've been following ever since.
With all this good work that we have been doing, we have also managed to create a network in Europe with a lot of pharmaceutical companies who now know that CTF is a serious player in the market.
One of the best parts of working with the NF community that it feels like working within and for a family.
I very much enjoy working with CTF. It's a very humbling experience to also get to know NF patients and to know that the work that is being carried out has a meaningful impact.
The Champions Award is a unique honor, and it's one that is something I'm personally very proud of. It's an award from people with whom I have shared not just a business relationship, but a personal relationship.
We don't work alone. We work with the NF community and we work with CTF. So it's wonderful to get this award, but I don't think it would be possible without their passion and their partnership.
I get up every day and I think about ways we can advance the mission of the Children's Tumor Foundation. And we do that through our advocacy here in DC. We do it through developing networks to try to develop a pharmaceutical strategy so we can make this disease history.